Did you know most healthcare admin candidates stumble on patient care questions? In this video, you'll discover the top 5 interview questions and their example answers that will help you shine in your healthcare administrator interview. Stay tuned to learn how to effectively communicate your experience in improving patient care. This question dives into your leadership skills during transitions. Describe a time when you had to lead a team through a significant change in your healthcare facility. Interviewers are keen to understand how you manage change, communicate effectively, and support your team through challenging times. To tackle this question effectively, consider these tips. First, identify a specific change that is relatable to the role, such as implementing a new electronic medical record system. Next, highlight a communication strategy that was crucial in the process, like regular feedback sessions, to keep everyone aligned. And finally, mention a challenge you faced and how you proactively addressed it to minimize disruption. This demonstrates your problem-solving abilities. Here's what a strong answer sounds like.
When our facility transitioned to a new electronic medical record system, I led the team through the change. I organized weekly meetings to discuss progress and address concerns, ensuring open communication. One challenge was staff resistance to the new system. I arranged additional training sessions tailored to different departments, which significantly eased the transition. As a result, we successfully adopted the new system with minimal disruption, improving our operational efficiency by 20%.
All right, let's dive into resolving conflicts like a pro. Here's a crucial question for healthcare administrators. Tell me about a time you successfully resolved a conflict between staff members in your healthcare organization. Interviewers use this question to gauge your conflict resolution skills and your ability to maintain a harmonious work environment, which is vital in a high-pressure setting like healthcare. Let's look at some strategies to craft a compelling answer. First, identify the root cause of the conflict, which demonstrates your analytical skills and understanding of the situation. Next, describe how you ensured all parties felt heard, because empathy is a critical skill in healthcare environments. And finally, share a proactive step you took to prevent future conflicts, showcasing your forward thinking and initiative. Let me show you how to put this together.
During a particularly busy period, a conflict arose between 2 nurses over shift scheduling. After listening to both sides, I discovered the root cause was a misunderstanding about shift preferences. I facilitated a meeting where both nurses could express their concerns and collaboratively find a solution. By implementing a more transparent scheduling system, we not only resolved the immediate conflict, but also reduced future scheduling issues. This experience taught me the importance of clear communication and proactive systems management.
Now here it is, the question we warned you about. Get ready to tackle patient care improvements. Now let's tackle a fundamental question for any healthcare administrator. Give an example of how you have improved patient care in a previous role. Interviewers ask this to gauge your ability to make impactful changes and enhance patient outcomes. To craft a compelling answer, start by identifying a specific issue or gap in patient care that you addressed. Then, make sure to include quantitative data showing the improvement, such as reduced wait times or increased patient satisfaction scores. Lastly, mention how you collaborated across departments to achieve the result, highlighting your teamwork and leadership skills. Here's what a strong answer sounds like.
In my previous role, I noticed that patient discharge times were causing delays and reducing overall satisfaction. I initiated a project to streamline the discharge process by coordinating with nursing staff and the IT department to implement a new electronic discharge procedure. This initiative reduced discharge times by 30% and improved patient satisfaction scores by 15%. The collaboration among teams was crucial in making these improvements possible.
You're halfway through. You've covered team leadership, conflict resolution, and patient care improvements. Keep up the great work as we dive into managing outbreaks and resource allocation. You're learning the questions, but knowing them isn't enough. Mock Interview Pro builds a healthcare administrator preparation plan. You practice answering out loud, get real feedback, and sit through a mock interview that feels like the real thing. Link in the description. You've tackled the toughest question. Now let's see how you'd handle an infectious disease outbreak in your facility. Here's a challenging scenario that's crucial for healthcare administrators. How would you manage a sudden outbreak of an infectious disease in your facility? Interviewers ask this to gauge your crisis management skills and your ability to maintain safety under pressure. Let me walk you through some essential elements to include in your answer. First, highlight how you'd ensure rapid communication with health authorities and your infection control team, as this is critical in managing any outbreak. Next, emphasize your ability to set up immediate isolation and protective measures to curb the spread. And finally, discuss how you'd proactively monitor the situation and make adaptive decisions as new information becomes available, showing your ability to lead effectively in dynamic situations. Here's what a strong answer sounds like.
When faced with an outbreak, I would quickly notify local health authorities and engage our infection control team to assess the situation. I would implement strict isolation procedures for affected patients and ensure that all staff have access to personal protective equipment. Clear communication is key, so I would hold regular briefings with staff to update them on the situation and reinforce safety protocols. Additionally, I would set up a monitoring system to track the outbreak's progression, allowing us to adapt our response as needed to protect both patients and staff.
Last but not least, how would you manage a critical staff shortage and still maintain quality care? Let's explore a challenging scenario. Imagine there's a shortage of staff on a critical day. How would you allocate the available resources to maintain patient care quality? This question tests your ability to prioritize effectively and think strategically under pressure, which is crucial for a healthcare administrator. First, identify which departments or patients have the most urgent needs. This ensures you're focusing your limited resources where they're needed most. Next, if possible, use specific cross-training examples to demonstrate your flexibility in resource allocation. And finally, explain how you maintain communication to keep the team aligned and motivated, which is key to a smooth operation despite the challenges. Now, let's hear how a strong answer might sound.
On a particularly busy flu season day, we were short-staffed due to unexpected sick leaves. I first assessed the patient triage area, as it was crucial to keep patient flow steady. I cross-trained some of our administrative staff to assist with basic patient intake tasks. Then, I communicated with the nursing team to prioritize high-risk patients, ensuring critical care needs were met first. By holding quick huddles every 2 hours, we kept everyone informed and motivated, ultimately maintaining a high standard of care throughout the day.
Your interview is coming. Stop preparing alone. Mock Interview Pro builds a healthcare administrator preparation plan that adjusts to your timeline. Even if your interview is this week, it focuses on what matters most. Targeted practice, AI feedback, and a live mock interview so you walk in calm and clear. Start your preparation plan now. Link in the description. In today's video, we explored key strategies for leading change, resolving conflicts, enhancing patient care, managing outbreaks, and resource allocation during staff shortages. Remember, your ability to adapt and lead effectively is your strongest asset. If you found this video helpful, consider subscribing for more tips. You're ready to go crush that interview.